Hi there, I'm Dr. Richard Goldberg. I'm a GI oncologist who specializes in the treatment of people with colorectal cancer. When we discover a colorectal cancer, the first step is to remove it from the person. We take that specimen and look at it very carefully because it helps us to determine the treatment paths that we're going to recommend to you. The first thing we do is called staging. Staging is like taking an inventory of the cancer. We look at the cancer that was removed, and then we look at the rest of your body to determine if there are any signs of cancer outside the area where the cancer started. When we look at the cancer itself, we try and determine how deeply the cancer is invaded into the wall of the colon and whether or not it's spread to any lymph nodes. The surgeon helps us do this by handing us a surgical specimen, which is examined very carefully by pathologists in the laboratory. This tells us the local stage of the tumor. We then want to do some studies, including CAT scans and sometimes PET scans or other x-rays, to help to determine whether we're going to find disease outside the area of the colon. These tests taken together, the pathology and the x-rays, can help us to determine how far the cancer is spread. There is, however, another thing that we need to do, and that is to try and assess how the tumor is going to act. We do that by looking at it under the microscope and determining whether it looks aggressive or not so aggressive. And the other thing that we do is to check biomarkers. If you have stage 2 or stage 3 colon cancer, that is colon cancer that's limited to the colon and the lymph nodes, then a diagnostic test is available that provides more information about the biology of the tumor. This biologic assessment will give you and your doctor more information about the likelihood of your cancer returning. We call a return of the cancer a recurrence, and initially when patients with stage 2 and 3 colon cancer, we use chemotherapy to try and avoid recurrence. This test can help you and your healthcare team decide on treatment strategies, such as whether or not to take chemotherapy. The goal is to understand as much as possible about your tumor to help make the best decisions about your treatment program and give you the best possible chance for the best long-term health.